I'd like to introduce Dr. Mullins, who's a professor and chair of the Pharmaceutical Health Services Research Department at the University of Maryland School of Medicine, and Rodney Elliott, who's an international basketball player, and me and Pops Inc. founder.
You'll hear more from Rodney and myself in a minute, but one of the things that we do with the University of Maryland Patients Program is we always start off everything we do with the voice of the patient.
My name is Gail Graham, and on April 29, 1997, I was diagnosed HIV positive. Once I was diagnosed, I experienced everything from family disowning you to family members that was in your life giving you paper plates to eat off of. No one wanted to talk to you, much less touch you or be around you. And finding the right health care was a hard time, because at that time it still was, my doctor only had one other patient who was positive. So he didn't know what to do with me. So at that point I made it my life mission to start learning about it, teaching other people about it, so that they didn't have to go through the same thing that I went through. With that experience, I was a board member on the Baltimore City Commission on HIV and AIDS. I'm also a board member on Johns Hopkins ACTG unit, and I've worked with different other organizations and researchers. And one day I was volunteering for my church, and my pastor was meeting with a group of researchers. And he came into the office and he said, "Gail, can you come into this meeting with me?" And I said no, because whenever he asks something, you know he's going to ask you to do something at that point. So I said no. So he just looked at me. He said, "No, seriously, can you come into this meeting with me?" I said, "No, seriously, I'm not coming into the meeting." But went into the meeting, and Dr. Mullins was there with his team. And at that point, I really didn't want to hear what he had to say, because I was busy with a lot of things going on. I've had my own experiences with researchers come into the community, not respecting the community, just getting what they want and leaving. So I didn't care what he had to say. So he gave this brilliant speech and everything. He talked about his program, and then he looked at me. He said, "Would you be interested in it?" No. So, you know, and he was surprised, and he just looked at me, and then he rephrased it. And, you know, so now do you think? No. So he didn't give up. He became like a little pit bull. So he gave me somebody else that was on his team. He said, "Well, would it be okay if she just called you sometime during the week, maybe around lunch, and y'all could talk?" So at that point, I just wanted to get out the meeting. I said, "Yeah, okay, whatever." So when a young lady came and met with me, she gave her spiel and everything, and I said, "No, not interested whatsoever." So one thing my church does, for World AIDS Day, we do a Testing for Turkey event, where anyone who comes to get tested at the church, because we do offer free HIV testing and counseling there, they would get a free turkey. So Dr. Mullins knew about it, and they wanted to have a table at our event. So I was thinking, okay, I'll put them in the back in the corner, somewhere where I can see them and make sure that, you know, they don't interfere with what's going on. So the group shows up. It was 2 people that showed up, and they were early. So they looked around, and they saw the community that was coming in, and they came up and said, "Excuse me, would you mind if we went and got some coffee and donuts for everybody?" And I said, "Everybody who?" And he said, "Well, for the community and the volunteers." I said, "That would be nice." So they went and they did that, and they came back, and next time I looked around, I saw them sitting with the community. Not just sitting with the community, but actually touching the community and listening to what they had to say. From that point on, I was a part of Patients Program.
Everything we do, it's because we've learned from the community, and Gail has really taught us a lot about partnership, right? Because too many times universities do go into the community to get what they want, and once they've gotten what they want, they're gone. So we try to be part of our community. So how many of you, if you had a professional basketball career in Europe, would retire early to take care of mom? This is Rodney Elliott.
Probably have to move this up, but okay. That's usually how it is. Again, thank you. Good morning. To literally piggyback off of what Dr. Mullins was saying, that's exactly what I chose to do. You guys saw the clip in Maryland, Jersey, and everything. I don't know how many Georgetown grads we have here, but there was a game the other day that Maryland came out on top. Just want to say we appreciate it. We appreciate it. But yeah, I got introduced to the patients program, Dr. Mullins, through a mutual friend, and the relationship has been great so far. Out of it has come a lot of positive things for the community. Initially was the caregiver video. My mom, I like to say she won the battle against cancer a couple years ago. She didn't lose it because she was an awesome woman, awesome wife, mom, provider, caregiver for all of her loved ones and people around her. Anybody who knew her knew that. So when the day the doctor told her and my dad and her sister that they were going from curative care to palliative care, she embraced it. It hit me like a brick wall, like hit me like I just ran into a brick wall, but she embraced it. And every day after that, I made it my effort to give my all for her, do anything I could possibly do to make her last days memorable. And one of the things that, the correlation between that and the pension program is doing for me right now kind of brings me back to a story when we all was little. We probably can relate to this, either when we were little or when we have kids. When they don't want to, when they get up in the morning and say they don't want to go to school. I did that a bunch when I was little. Mom, I'm not feeling well. I don't want to go to school. And she would take her hand and put it on my forehead or put it on my neck and try to, check my temperature. Somehow, some days I would go get a hot rag and put it on there right before she left the room. So like, okay, I'm hot, right, Mom? I'm hot. And she was okay, yeah, you're hot, but go get dressed and get ready for school. I took that to the caregiver part. She was in hospice and she wanted to live home, so we literally gutted out the dining room and put the bed there and everything, had everything there, and my dad and I took care of her every day. And in the morning, I would get up and I would check the temperature, and that was our little joke back and forth. Later on, after I speak, I'm going to share about a program that myself and Dr. Giselle down there at University of Maryland School of Pharmacy, Giselle Martin, we came up with a program titled Me and Pops. And it's catered towards 11 and 18-year-old young men in the community and their father, their uncle, their mentor, their coach, whoever's a positive male role figure in their life. And it's to instill hope. That scene, the clip you saw, which I didn't even know he was going to show earlier about Mondawmin Mall, is real. That party there was real, but also that Freddie Gray scene was real too. And a lot of kids in that community are who that I like to talk about, who I directly want to have an impact on and help instill hope in it. So the Me and Pops program is my way of checking the temperature of the society, the community in Baltimore, where I'm from. Born and raised in Baltimore. I've had the opportunity to travel the world via basketball. Had a 12-year career over in Europe. It started out in Belgium. It ended up in Buenos Aires, Argentina. And in between that, I lived in Paris. I lived in Italy. I lived in Istanbul, Turkey, Australia. Some of the most beautiful places and cultures and people and scenes and mountains and scenes that I've seen that just are amazing. And when I talk to these kids and I try to build a relationship and I talk to these parents and I try to build a relationship with them, it's all in an effort to have them open up and just talk about what's going on in their school, going on in their home, so we can help them. One of my goals when I was little was to be a pro ball player. I did that, but also wanted to open up my own daycare center. I didn't get a chance to do that, but being with the Patients program, starting programs like Me and Pops with partners like Dr. Mullins in the Patients program has my mind and brain churning, just like it was when I wanted to be the best basketball player at the University of Maryland. So I'm definitely excited about being here. glad to be working with Dr. Mullins in the patients program.
The question was, do we go outside of Maryland? And yeah, so this study that we're supporting, this proton versus photon, is out of University of Pennsylvania. We actually are working with others right now on some future proposals, both to PCORI and elsewhere. Yeah, I mean, we may go internationally too. So we're happy to work with any researchers. The only request that we have is, one, that you are patient-centered, and two, that you give back if you want us to support you.
I'm Eduardo Vega with the Mental Health Dignity Project. I'm wondering, with regard to the array of programs, to what degree are people involved in sort of really formulating the questions and then kind of revising the questions? Because a lot of times, as you know, one of the things that we experience is that, you know, there's a research question set out. When the community gets involved, they say, well, you know, maybe we're more interested in, you know, how, you know, what we need to, you know, recover, you know, our lives rather than, you know, what this medication is about. Right. So I'm wondering, you know, I've been involved with the PCORI project that was very successful, but this particular aspect about, like, once we were in the mix, right, we really wanted to think about and ask different questions that the community was concerned with.
Sure. Yeah, so at the patients program, we have a 10-step framework, and the first 3 steps are before the research even starts. The first one is, what might we study? The second is, amongst what we might study, what are our priorities? And then the third is, assuming that it's worthwhile, framing the question. If a researcher is not on board with having their idea vetted, we won't support them, we won't work with them. And what we insist upon is that in the first page, even if there is a scientific research question, that in the application we need to have the question that was generated by patients who are affected by the condition or their caregivers. And that's our philosophy. And then we go through the rest of the steps, which is developing outcomes and comparators, developing the study protocol. So yes, I mean, we're very committed to that entire engagement rubric that PCORI has developed. And we actually currently have a contract with PCORI to further advance that rubric by figuring out exactly what means of engagement are best when you're, you know, first thinking about your question versus when you're doing your study versus when you're trying to disseminate. And what we hope is that working with PCORI that we can give people even more guidance on how to do this the right way.
Hi, everyone. Heather Olden, Henry Ford Health System. How many people do you have in the patient program?
So that's a good question. Our initial $5 million worth of funding comes from the Agency for Healthcare Research and Quality. So we have one of the R24. I know that you're affiliated with one of the institutions that has an R24 as well. And so we support other people's projects. We have a database of about 1,000 people whom we connect with on a regular basis. But the individuals who are in the study actually kind of, you know, in some ways belong to the other studies. And what we do is bring the voice of the patient into that research project. So many of the individuals whom we outreach to are being outreached to be advisors, such as yourselves, to a research project. And then working with the researchers, we then make sure that as they engage patients as human subjects in the research, that they do that in a very patient-centered manner. And we work with many of them to produce newsletters so that individuals who are participating can receive updates about the studies in a timely manner, which is another issue that we've had in research historically. But our role is very much a support role to researchers, you know, at Maryland and beyond. So the question is, how many projects in oral health do we support? And currently, this is a big problem. We are working with our School of Dentistry trying to get one funded, but we don't have one funded yet. And we have 3 questions that we've been working on them that we hope will get funded. One that addresses the fluoride question that many people are still, you know, concerned about. Many patients want to know if fluoride is good, is it bad, what's going on. One is about children's health and kind of really understanding how many things, including you know, sugary beverages, have impacted that, and how do we get people to make better choices. And then third is looking at adult care in the Medicaid program, where many states have really changed the way in which you qualify for oral health benefits. So I'm hoping a year from now we'll be able to say we are working on funded projects, but at this point we're just working on proposals. And if you have ideas, we'd be happy to work with you too.
How would you suggest we engage the community in this effort?
Yes, I'm going to actually see if Rodney or Gail have it. So the question is really about getting people to donate either blood or tissue or something so that we can learn more about DNA, so that we can figure out how to improve personalized medicine. And in the West Baltimore community, the answer is you can't right now. And so we're trying to figure out how to do a better job with that, same as in Boston, same as everywhere in this country. And I don't know if you have any ideas for how you would communicate this, but I definitely think it's the spirit of what we do, which is we can't go into the community and ask that. We have to have already been there and built that trust in order to say, look, we're not trying to re-engineer you, which is what people think. We're not trying to do something to you. We're not trying to fix you. We're trying to learn. And by your donating, we can learn more. But that's a hard sell. So either one of you can go first and take it away.
One of the ideas that I think could be was just building that relationship and building that trust. I know in Baltimore, a lot of people just, don't trust the medical field. And when you have people like yourselves who want to help and have important information and data to get to them, if it's unfamiliar to them, they don't understand it. They shy away from that. So building a relationship with the community, I think, is very key, and that's whatever way possible, whether it's through seminars, whether it's through community outreach events, all in an effort for the big picture. The big picture is health and improving yourself. But if I don't know you or unfamiliar with you or not used to you, then I'm going to stick with what I know. That's just kind of the temperature of what some of the communities are faced with.
One thing I would suggest is, in the hospital when you're in the clinic and they have the programs on TV, if you could have just like a small video or video created, and then that video could be played in all different clinics. So that's educating the community. So when, once you see that, then if somebody came up, at least they'll have a thought of what it is. So that might be another thing that you can do also.
Kudos on that Me and Pops. That is awesome, really awesome. And a lot of the work that I've done has been in autism, and I've done work with parent training, but parents have almost always been mothers. And so we're really interested in engaging fathers, particularly. Can you talk a little bit about some strategies you've used to engage fathers who typically have been underrepresented?
Yeah, one of the gentlemen in the video named Rod Stokes, he's the owner of the Regeneration Project in Baltimore. And it's a nonprofit organization that deals with PRP work, both men and women. And one of the things, besides promotion via social media and things of that nature, we try to get people who have a database of kids, and whether they're dealing with autism or whether they're dealing with social skills, lack of social skills, we try to make it a point where it's not just us or myself or a panel of people talking to you and feeding you a bunch of information. For example, my seminar, it's on a daily basis. We come in the morning, we have breakfast, we have a meet and greet. Then we also have a lot of poignant speakers throughout the community come in and speak and share different goals and dreams and ideas for on success and how they got to where they are. And part of it is my vision board activity. I take it back to elementary school. We literally go back and have poster boards and have old magazines, and we glue sticks and have the kids and the dads and the uncles, whoever the positive male role figure is, put together a vision board so the kids can kind of see and literally, where they want to go, where they want to be, some of their goals and dreams, aspirations, and have that dialogue between that father and son, that uncle and nephew or whoever it is. And I don't know too many dads that don't want to be a part of their kids' lives. And for the ones that don't or struggle with that, we try to create scenarios where, you need to be and make it important. You need to be. So now you'll see more pictures of parties and fun in Mondawmin instead of, the other pictures that were seen. So it's challenging, but again, I'm learning as I go along and finding different ways. But, that linear relationship between father and son helped me out a whole lot when I was coming up out of East Baltimore, dealing with my dad was in and out of my life. That coach-player relationship was big to me as well. So my idea is just trying to figure out where they are in the community and meet them halfway. So I go out to the schools, I go out to the gyms, recreation centers, I go to the playing fields, and again, have a discussion. I put the University of Maryland pitch up there because I really want to use that platform as well to a certain degree. You know, my face is still kind of relevant a little bit, and that'll get the attention. But a lot of times after the seminars or the meetings I have, a lot of the parents come up to me and say, okay, well, what's next? So, you know, that's enticing, engaging, and I'm learning along the way.